Good day, everyone, and thanks for joining us on today's ICFJ Global Health Crisis Reporting Forum. My name is Paul Adepoju, and I'm glad to introduce our speakers today from the International Organization for Migration. And the focus of today's webinar is on covering migrants and migration in a global pandemic. While attention has been on vaccination, testing, and other aspects of the COVID-19 response, there are several others too that also deserve to be given attention to. And today we'll be looking at these issues that affect migrants from a whole different perspective, so that journalists and every other person that is on this webinar would have a much robust understanding of the key issues that migration ecosystem is dealing with, how they are dealing with these problems, and how this pandemic has uniquely affected them. And the goal of having this conversation actually transcends beyond COVID-19. It's also an avenue to ensure that journalists also start thinking about migration and migrants anytime we talk about health issues. And we have a thorough and professional group, two amazing individuals from the IOM that will be doing justice to this. We are going to start with Saskia Kok, who is with IOM Nigeria and heads migrant protection at this organization under the United Nations. So thank you, Saskia, for joining us. How are you doing today?
Very fine. Thank you so much for the invitation. It's lovely to meet you and everyone else.
Yeah, thank you very much. Are you ready?
I'm ready. Yes, thanks.
So it's over to you. So have fun.
Thank you. I hope you can all see my screen.
Yes, we can.
Great. So yeah, my name is Saskia. I head the Migrant Protection and Assistance Unit at IOM Nigeria. And today I'm just going to walk you really briefly through some of the interventions and programs that we are implementing, as well as how this is affected, has been affected because of the COVID pandemic. Okay, so IOM Nigeria has a number of programs in place that are funded by donors such as the EU, the UK, the Netherlands, as well as Switzerland and Germany. And our overall objective of the work that we do here in Nigeria is essentially to provide sustainable reintegration support to returning migrants, including vulnerable migrants, as well as to support the government in managing migration in a more sustainable manner. Now, what does that mean? It means that we're looking at a number of areas. So number one is governance and policy. So we have targeted interventions that essentially focus on the governance of migration through the development of migration strategies and implementation of migration policies. So we have worked together with the government to review and adopt an action plan for the migration policy, for the labor migration policy, the diaspora migration policy, but also the standard operating procedures to what we call assisted voluntary return and reintegration. So IOM in general, for those who are not familiar with the organization, part of our mandate is to provide safe, dignified and voluntary return to migrants who are unable or unwilling to stay in their country of transit or destination. And this includes maybe failed asylum seekers, trafficked victims, unaccompanied and separated migrant children, and so forth. So we work very strongly with the government here also in Nigeria to improve migration management structures. So that second component is essentially where we are focusing on providing direct assistance as well as reintegration support to those who have been returned from a variety of countries, which include reintegration support, rehabilitation support, but also to strengthen national and state level structures to manage migration in a sustainable manner, as I mentioned earlier. So you could think of the establishment of state level task forces, technical working groups, but also working together with our partners to provide targeted trainings in a variety of areas, including with partners who are health service providers, how to identify a vulnerable person, how to protect a vulnerable person, and to provide that person with assistance, amongst others. Another component that we work on with our government is awareness raising, so prevention of trafficking in persons and irregular migration. And this includes targeted interventions to enable migrants to make informed decisions about their migratory journey. Unfortunately, there's still a lot of migrants who are misinformed, who are led by people who lure them for false promises to countries such as Libya, but also Europe and any other country in the Central and West Mediterranean route. So our interventions focus on building that awareness with our potential migrants and the community. Finally, migration data. So we work with the government to strengthen migration data and communication on migratory flows. Well, as journalists, you must know how important it is to actually have this data available and to be able to actually report on this data without jeopardizing any of the ethical considerations. So we also have established structures. You might be familiar with the DTM displacement tracking monitoring matrix that we are implementing, as well as the reports that are coming out on a regular basis. So this is just a very brief overview. IOM Nigeria in the past 3 years has returned more than 21,000 migrants from a variety of countries. So this includes Libya. As you can see, 83% of migrants that we have returned come from Libya, followed by countries such as Niger, Mali, Germany, Morocco, but also other countries in the Central and West Mediterranean route. So this is actually a quite large list. So I've just listed the top 5 countries of return. And I think in the context of COVID, it's very important to realize that even before COVID, the people that returned were exposed, for 70 or more percent, were exposed to any form of violence, exploitation, and abuse, and came back with specific needs. So one can think of health needs, medical needs, but also specific vulnerabilities with respect to psychosocial support. And of course, also most of the returnees are in debt and have very low economic stability when they return. So that's why the reintegration support that we provide is such an important component of helping them reintegrate back in their home communities. When, yes, okay, so maybe just to share with you some overview. So when we do a couple of surveys also when people return, and this includes the top 5 intended destination countries of returned migrants. And you can see that the majority of those who returned wanted to go to Libya, but mostly also to Europe, such as countries like Spain, France, Germany, as well as in Italy. Now, these trends have been fairly similar over the past couple of years. Yeah, are an important kind of push factor for people leaving the country for better economic employment opportunities. I just wanted to share you a picture of one of our examples at the reception and post-arrival stage, where some of our returnees came back from Libya and other countries. So now turning to the COVID-19 pandemic. So the COVID-19 pandemic actually disrupted quite a large part of our programming. We in Nigeria, there were lockdown directives by the state, of course, and the federal government of Nigeria since March 2020, and that kind of continued until the end of the year. So these lockdown directives included travel movement restrictions, but also health and safety regulations. So this also meant that in Nigeria, there was little flexibility to move around, as we all know, in other countries as well, which also had an impact on the economy, supply chain disruptions, as well as the inability of people to be reunited with their families. This was especially important when looking at migrants who were still stranded in other countries. So in general, we saw a significant increase of migrants who were unable to return home, who were already stranded prior to the pandemic, or those who actually became irregular during the pandemic. For example, as I mentioned, we have a couple of countries that are specific countries where we have returned migrants, but during the COVID-19 pandemic, we saw a significant increase in migrants who were stranded in the Middle East, mainly due to the fact that employers were no longer able to keep Nigerian migrants employed at the time, and because they were already in exploitative conditions. So we saw a large push of Nigerian migrants in Lebanon and Oman going into irregular situations and into trafficking situations who needed assistance to return. The same applied also for those stranded in Mali, Libya, and other countries. In the country itself, in Nigeria, of course, we have a very large portion of returned migrants who also were affected by the pandemic. And I think what is important when we look at migration and migration in the context of COVID is that most of the time, migrants do not have equal access to health services, especially when they're still in transit. They might even have exposed vulnerabilities due to their exploitative journeys that they went through, including psychosocial support, and so on. So usually the persons that we deal with are already vulnerable, but the COVID-19 pandemic exaggerated those vulnerabilities. So there was a strong need to coordinate closely with the government and other ministries to see how we could step up and provide needs-based assistance, but also to continue the support that we are giving in country to vulnerable beneficiaries. One way of doing this was we conducted a survey amongst our beneficiaries. As you can see, we conducted the survey amongst beneficiaries, family members, community leaders, and partners. And there were a couple of key findings that we utilized in our programming. The most important one, that 96% out of everyone who was surveyed indicated they were financially worse off than before the pandemic, with 91% indicating their psychosocial well-being had deteriorated. So for us, this was a very important, let's say, finding that prompted us to redefine also the way that we did counseling, but also prompted the need for us to provide and develop more targeted interventions for people with such needs. So this included the provision of additional cash-based support, complementary assistance, but also continuation of partnership building with our government and non-government partners. As you can see also from the results, the same effect also was seen amongst family members. Where there's a significant, where there was a significant impact on the family situation, including the psychosocial being. And the reason why this is so important for us, for IOM, is because all of these factors that we're now looking at, psychosocial being, economic stability, amongst others, essentially puts another strain and another effect on the push factors for irregular migration. If people are not able to take care of themselves, they're not in a good psychological state, and they're struggling financially, the risk of being re-trafficked or re-smuggled is quite high. So of course, for us, it's very important to make sure that we help those who are most vulnerable and those who are most impacted. So one of the mitigative actions that we took was to strengthen home-based rehabilitation and reintegration support, but also to boost mental health and psychosocial support activities, with focusing on COVID-19 related messaging. So we have it targeted within my team. We have a targeted MHPSS team who actually develops interventions for families as well as returnees to help them cope with some of the stressors and stress concerning migration, but then in particular in this instance also for COVID-19. So we piloted some family strengthening sessions to train them as caregivers, especially those taking care of returnees. But also we developed some targeted information education brochures to help them cope with some of the stress regarding the pandemic. Of course, a large portion of what we do is also direct assistance and referrals. So that assistance never stopped and was also intensified. One component that I would like to highlight is also the coordination and linkage to national response actions. For IOM, it's very important to, especially when you look at stranded migrants, those who need assistance to return, and those who need to be supported in Nigeria reintegration, is to coordinate closely with the government. So the government of Nigeria set up a presidential task force, and during the pandemic period in Nigeria, when it was at its peak, we tried to open up what we call humanitarian corridors, so that those who were stranded and not able to return were actually able to return. So these are basically special agreements one would have with the governments, for example, the government of Lebanon and the government of Nigeria. So this is basically an overview of some of the challenges that we faced. So during this period, we assisted quite a large number of vulnerable migrants from Lebanon, from Mali, and also from Niger and Libya. We actually had a recent return flight yesterday. And part of our approach, of course, is also to see how we could strengthen the response and facilitate some of the COVID-19 related regulations that were set out by the government, including identifying, making sure that the PCR testing was done before travel, as well as upon arrival, making sure that the quarantine period was coordinated. And of course, also in case there were positive cases, for subsequent referral to be done. So this is just basically an overview of how we implemented or we managed still to open up some humanitarian corridors during this period. Of course, we're still in the COVID-19 period, but we had a peak last year. This is an example of the MHPSS information education materials that we developed. So yeah, as I mentioned earlier, the objective was very much focused on reducing the impact of COVID-19. So here I'm highlighting some of the mental health and psychosocial support interventions, part of which was the development of this brochure. So basically our work is situated in a larger framework that we call the National Referral Mechanism. So it's essentially a national-wide framework where our partners providing assistance to vulnerable individuals take part and also have their roles and responsibilities. So these examples were also done in coordination with our partners to ensure that the self-help that was offered to returnees also would end up at the right persons. As mentioned earlier, most of the time, the stressors that families and returnees face are important drivers for irregular migration. This was already the case before the pandemic, and which became worse during the pandemic. So we very much focused on providing these self-help tips and training families who are acting as caregivers. And these interventions are still continuing, of course. They have not stopped, and we're actually intensifying this at the moment. My final slide is prevention. I will not talk about everything that we're doing. Our program is quite large, but I just wanted to highlight some of the elements that we're focusing on as IOM that might also be of interest to you as journalists. So a large component of our work is focused on prevention. As I mentioned, we have a range of consultations with the community, as well as a range of consultation with partners and non-government partners who are working in the area of migration. So the information, education, and communication materials that we had established that are aimed at informing migrants about the risks of irregular migration, the benefits of safe migration, etc. They were contextualized to the COVID-19 pandemic. And subsequent outreach. Of course, we could not go into the field in the initial stages, but we tried to reach out to our returnees through social media. But I think the most important component that we implemented at the time was to engage other returnees. So we have developed what we call volunteer field officers, who are actually returnees, but they were trained in peer-to-peer education. So they would go into the field, of course, taking into account the COVID-19 regulations, and they would support the program by reaching out and providing sensitization sessions on COVID-19, on making sure that you take care of yourself, self-help tips, and also generally to inform people as to know where to go when they had issues or when they had symptoms. So, the washing, but also wearing the mask, as well as where the health centers are in Nigeria. Generally, the target group that we work with are generally lower educated. So that's why it's important to have these materials to be contextualized to the context, and also to make sure that we work together with our partners, including journalists, to make sure that this information also reaches the beneficiaries. So these were some of the general considerations. It was quite it has been, and it's still, of course, quite a difficult time to continue. And we have seen quite a significant increase in the level of vulnerability in terms of people here in Nigeria coping with the economic side effects of the pandemic, but also, still the increase of migrants who are stranded across the various countries. And at the moment, we have implemented and we're trying to implement some additional interventions to support those who are stranded together with the government of Nigeria. I have about 10 or 15 minutes. I think this was the most important thing that I wanted to mention. Maybe I can just thank you all very much for listening, and I'm happy to answer any questions if there are any additional questions. Thank you so much.
Thank you, Saskia. And yes, thank you very much for that. What I will describe as a quick overview into what migration is, because I know it's actually much more intensive than that. But thank you for being able to pull that up within the available period of time. And I would endeavor every person on this participating in this webinar to keep those coming. So if you are joining us from Zoom today, please submit your questions on the Zoom chat, which you will find in the menu option below. And if you are watching from Facebook live stream, please post your questions in the comments below the video also. And these questions will be taken and dealt with at the end of the second part of our presentation. And I hope Yasmina is still with us. While we wait for, maybe we can take an interlude while we wait for Yasmina to join us. Let's see if we can get some questions. Now, so one question is for you now, Saskia, while we wait for Yasmina to join us. So the question is, given the worsening the economic or health situation in Nigeria, do you have any observation whether and how many returnees would consider making the journey again? And many of the push factors have not been reduced, but exacerbated during the pandemic. So let's take that question. Can you take that question right now?
Sure. Yeah, no problem. I mean, generally, it's quite difficult to, let's say, track outgoing migrations. What IOM does is when we talk about migration statistics, we're usually very accurately able to, record and track So, for example, the number of migrants who come back from countries that have traveled through irregular means. But in general, what we have seen with the COVID-19 pandemic, of course, as rightly mentioned, the socioeconomic side effects of the pandemic are quite severe. And it is expected that the pandemic has a significant influence on irregular migration. But it's also important to note that because of the movement and travel restrictions, initially, we saw a reduction of irregular migration trends. Because of course, people are not able to move. So, and we believe that these migration trends actually have a ripple effect. Now that the borders are opening up again, and people have actually been pushed into those, maybe lower economic situations, we do expect additional, let's say, trends of irregular migrations to arise. It's hard to pinpoint a number. Nigeria has, 190 million people or so. But of course, it's very, very clear to say that it's expected. I mean, just generally on the figures, though, at the moment, for example, there are still 40,000 Nigerians estimated to be stranded in Libya. We still have about 500 migrants or more that are stranded in Lebanon and Oman. And then I'm not even talking about the other countries. So the number is quite significant, and we do expect these trends to continue to rise over the next couple of months, if not years.
Yeah, so thank you very much. We are going to come back to the other questions after we take our other presentations. So ladies and gentlemen, I'm happy that Our second speaker is back with us now. She's Yasmina Guerda, and she's with she's IOM's Public Health Communications Officer, and she's going to help us in really narrowing and zeroing in on the health aspect of migration. So Yasmina, we are happy that you can join us. How are you doing today?
Hello, hello. Yes, I had a small accident. I don't know why. My computer crashed. I'm very sorry. Can everybody see the screen?
Uh,
Is it working?
it has started sharing. I think it will load
Yes.
eventually.
Ah, okay. Yes, I had an issue when I tried to project. That's what the crash came from. So a bit concerned now. Very sorry about that. Is it still not coming
I
up?
think it's frozen. Is it possible to quickly share with me via email so I can project from here for you?
Yep. I'll share it
Yes.
with you right now. Very sorry about that.
No, it's perfectly okay. So I think maybe while we do that, let's ask her be taking the other question that we have for her. So Miriam is asking you, where can I find exact accredited resources and statistics about the impact of COVID-19 on the refugee crisis, on migrants, or the different aspects of migration in relation to COVID-19? And the person said, I tried to search UNHCR and IOM websites, but precise statistics are not available about that exact call. Please correct me if I'm wrong. So can Saskia take that question while we sort out Yasmina's slide?
Sure, thank you for the question. We do actually have quite a number of resources available, but yeah, you do need to know where to find it indeed. So there's a website that is called migration.iom.int, and you can find a range of resources there, and it's publicly available, and it follows the DTM, the displacement tracking matrix that I was just mentioning earlier. So it doesn't only you cannot only find reports on recent, let's say, trends, but also about, country-specific trends, regional trends, global trends, trends in Europe and the Mediterranean. So it's actually quite a good resource if you want to also compare irregular migration trends or trends, between the different years. So 2016, 17, 18, 19. So that's the most predominant website in terms of data. But of course, IOM also has a publications website. So that's also an area where you can have a look for those type of resources.
I think we have Yasmina's slides up. So I think it's good we take presentation now. Yasmina, so we are ready if you have.
Thank you so much for your patience. So sorry again. I want to talk to you about the health aspect specifically. And how to tell the story around it. A lot of things have been touched upon by Saskia already. Before we get started, I wanted to ask if you can write in the chat box as I get into definitions. I wanted to ask you if you could tell me, when we say migrants' health and migration health, what is the first thing that may come to mind in terms of stories to report, or what people think about it? Like, what are some of the things that you may think of, and then I'll get started on definitions. But if you can already type that. So we'll talk about migrants and health before COVID. We'll talk about the impact of COVID on their health. We'll talk about the vaccination campaigns that are coming up and that a lot of you are going to be covering. And then a few things about on how to report on migration health and the health of migrants in particular, and tell their story. So defining migrants is something I want to get started on, because everyone has their own sort of idea of what that word covers, and I think that's very important that we get to it, especially because there is no international law definition. It's a term that covers a lot of different statuses and a lot of different people. And overall, everybody will agree that a migrant is someone who's moved away from their usual residence, and it can be within or across a border, an international border, or it can be temporary, or it can be permanent. It can be for a variety of reasons. For studying, it can be for work, it can be because you have no choice due to war or a natural disaster. You can do it, through the regular pathways. You apply for a visa and then you travel, or you can just get on a boat and go somewhere. And of course, as I was saying, you can be doing it as a planned, chosen thing, or you just have circumstances that are forcing you to do it. So that's important. What we're talking about here is refugees. We're talking about IDPs, internally displaced people. We're talking about asylum seekers, so people who have crossed borders and are looking for asylum from another country. We're talking about the returnees. Saskia was talking about returnees a lot. So it's people who have migrated and are now back in their home, and the implications that has on their health and on their communities. We're talking about people who have the proper documentation, and we're talking about people who don't have the proper documentation, that we often call irregular migrants or undocumented migrants. Some people call them illegal migrants. So those are all of the categories of people we're talking about. So you see, it covers a very, very broad variety of people. And so, of course, it covers a lot of different health issues. So in terms of health, I also want to clarify that we're talking about the physical health, so having a disease or not having a disease, being pregnant, not being pregnant, being exposed to a health risk or not. It means also the mental aspects of health, and it means also having a socially healthy life, so being able to have networks and support systems, and a source of income that keeps you healthy. So those are all the things we're talking about. So I hope some of you, I can't see the chat box, but I hope some of you have been able to type a little bit what their thoughts are about migration and health. Paul, is there anything in the chat box that you could tell me about?
So yeah, we have a number of comments, and
Great.
so
Let's hear them.
Now, so somebody is asking, where did you get the data on refugee deportation from? Are there any open source databases on that? I think many of our journalists are interested in having access to this data. So
right.
What can you still share with them?
Has anybody brought up what the relationship between migrants and health, and what that evokes, and where to find stories? Has anybody answered that question?
So I didn't get that. What did you say?
I take never mind. I think we're going to be running behind otherwise. So let me just jump in directly. So the dynamic relationship between migrants and health, that's important. That's something that I really want to spend some time on. Migration affects health, and health affects migration. A lot of people think it only goes one way around. It's actually both ways. So why and how you migrate will have consequences on health. Your health and the health of your family, and the health of others, the communities you leave and the communities you join. And in return, health has consequences on migration. Again, the communities you join and the communities you leave behind. So the reason why I'm bringing this up is because that, again, there's a very big, wide variety of situations. Let's go through some of them just to help you understand where you can find stories, and where you can investigate and really get the human aspect of all of this going. If you're migrating due to a drought, or due to a flood, or due to a famine, you are probably in for health. But if you're migrating for work or as a student, you will have to go through a lot of hoops, including health assessments and tests. And then as a migrant, you're probably among the people who is the healthiest in your community. So it's interesting, because a lot of people have this notion, unfortunately, and we've seen it tremendously during the COVID-19 pandemic, the notion that migrants are disease carriers. And that is incredibly erroneous, because again, when you need to migrate for work, when you need to migrate for students, for studying or other reasons, you are often among the healthiest. If you've migrated for you know, if you, in the course of your detention, you were arrested and put in detention, then your health is affected as well. So there's a very, very strong relationship. One impacts the other, and that is a very interesting thing to analyze. I was a reporter for several years, and I think that is something, that dynamic between health and migration, between health and migrants, is a very interesting thing to look into and to investigate, because it goes in all directions, and it's very fluid. One thing that's very important to understand is that a lot of migrants, again, depending on their different statuses and their different circumstances, might or might not experience important barriers to health. And these are very important stories to tell. The administrative barriers that migrants face, and I'm talking about pre-COVID, right? That's the setting. The setting is, if you're a migrant, you will have, more often than not, barriers to healthcare that people who are not migrants will not encounter. So administrative barriers can be, you know, all of a sudden you have to present an ID in order to access health services, or you have to present a work permit, or you have to be registered with the National Health Insurance Program. If you're a migrant in an irregular situation, you don't have any access to any of those documents. And sometimes, even if you're a migrant in a regular situation, you don't have access to those requirements. Sometimes, in some countries, the costs of healthcare are very high, and sometimes they're even higher for migrants, whether or not you're in a regular situation or not. That's a very interesting story to tell, especially during COVID. There's all the cultural barriers. They can be linguistic. So you're a migrant from Afghanistan, you find yourself in the US, you don't speak English, you don't have access to information, you don't have access to, you don't understand when the doctor speaks to you or when the nurse asks you questions. So all of that is going to limit your ability to seek support and health services. There's a lot of gender considerations that enter into the cultural aspects of the barriers that many migrants can encounter. And there's, you know, some communities, some countries make efforts to lift those barriers, and others don't. And so there are some countries where the situation of migrants in accessing healthcare is very worrisome. In other types of barriers, you have, of course, the fear that some migrants may face when seeking healthcare, that they might be arrested or deported. That again has to do with the papers that are required. And there are some countries, there are sadly some countries where automatically, if you report for health services, the person giving you that health service is under the obligation to report you to immigration, to the immigration authorities. And that, of course, is a massive, massive barrier to healthcare. There's the stigma, of course, as I was saying earlier, especially during COVID, there was a lot of xenophobia, a lot of stigma, you know, especially at the beginning when the virus was, you know, concentrated in one part of the world. And then yet another part of the world, all of a sudden we started seeing all of these discrimination behaviors. And so if you're a migrant and you get sick, you don't want to be discriminated more against by, you know, coughing or sticking or you know, seeking a diagnosis for whatever it is you have. So you're going to try to hide, you're going to continue to go to work. And all of that contributes to making your own health as a migrant worse, but also the health of the communities you're with worse. So these are very important things to report on, because it's not just the health of migrants that is at stake, it's the health of our entire communities. And these barriers, they end up posing a problem to everybody. With COVID, all of this just got worse, right? So before COVID, migrants were in many cases more exposed and less protected. Well, COVID just made all of that worse. Migrants oftentimes, when the restrictions came in place in March of last year, February, March, April of last year, a lot of migrants found themselves living in conditions that just could not accommodate for the requirements that the government was putting in place. For example, like the physical distancing or hand washing or sheltering at home, all of that. A lot of people just don't have access to running water, or they live in overcrowded spaces. And that was a very big problem in certain countries that use, for example, dormitories for migrants. So they were more exposed, the transmission was easier, and they were less. They had just no recourse. You know, it's easier to stay in good health if you don't, you're not living on top of each other, which is the case of some migrants, unfortunately. Some already, because of the reasons that I mentioned earlier, already had poorer health because of the circumstances of their migration, or because they don't have access to healthcare. They already have, what we call comorbidities, which is other diseases that make their exposure to COVID and their vulnerability to COVID even worse. Some of them lost their jobs overnight. You know how many restaurants closed, how many factories closed, and all of a sudden people found themselves without a job. So all of a sudden you're a migrant, you're living abroad, away from your family, and overnight you lost your source of income when you already don't have the same access to social services as everybody else has. I mean, that just made everything worse. Some of them actually had to continue working, and they had to continue working without the proper protection, because either they are, they're under situations of exploitation, or simply because they simply can't afford to have a day without income. So a lot of them felt compelled to continue to work at the same time when everyone was sheltering in place. Others were actually in the process of migrating when borders were closed, and they found themselves stranded in the middle of nowhere, like not home, but not at their destination. And that was a very, very big problem that IOM contributed to supporting with. But I mean, just imagine if this was your story, if this was you. Many are in detention, and the problem of health in detention centers is, of course, very big. Another very important place to look for stories. And then there was the increased stigma and discrimination that we all noted and noticed, and was reported on heavily, especially in the early moments of the pandemic. But it's coming back now with vaccinations, because there's this feeling that maybe there's not enough vaccine doses for everybody. And so by all means, let's prioritize the people who have papers, or the people who can afford it, or the people who didn't come here illegally. So these are some of the narratives that you're hearing, and that are rising now with the vaccination campaign. So again, migrants in this situation have been more exposed and less protected. And the toll on their physical and their mental health has been really heavy, with less ability to get help. So I hear the question about data, and data is a very important thing. So I'm going to take a break here just to talk about that. A lot of journalists come to IOM and say, I would need to know how much higher the infection rates among migrants and among displaced people is, and what the difference also is in the death rates. So that's data that's pretty much impossible to get. Here's why. First of all, governments do not disaggregate based on whether you're a migrant or not. When you show up at the hospital, you get tested, you get treated. There's no data being kept on whether the people who showed up were migrants or not migrants. So that already makes this data very difficult. The other thing is, as for all of the reasons that we mentioned before, migrants are less likely to get tested, and they're less likely to seek treatment. They can't. And so we're missing, if we were to give you official figures, it just wouldn't be accurate. And finally, the conditions vary so much based on which status you have, which status you don't have, which country you're in, what your migration circumstance was, the situation is very, very different. So we cannot provide these like large global numbers on how COVID-19 has affected migrants or not. What we can give you is the qualitative analysis and self-reported analysis. And there's been some studies, and I'll share them after the webinar very happily with the organizers to disseminate. There's been studies where migrants are self-reportedly, saying that they are, overall 20, 35% more affected by COVID. And again, this has to do with their living conditions, their working conditions, their migration conditions, their level of access to healthcare, and other things. On the other hand, and this is the other part of the story that is critical to tell. So the first part of the story that's critical to tell is why migrants are affected more heavily and what barriers they face in getting help. But the second part of the story that's incredibly hard and important to tell about migrants in the COVID-19 pandemic is how important and critical they have been, and how in the front lines they have been in this response. And this is across all the essential sectors. You may know that in research, for example, in finding the vaccine, it was, it was migrants who led the companies that found the vaccine. On healthcare, they are the ones who provide services in the hospitals, the nurses, the doctors. Transportation and delivery, migrants. The people who work in homes for the elderly, those are, or who do at-home care, those are migrants so often. Working in grocery stores, in the cashier checks and the restocking. The agricultural sector, in factories, the people who were producing masks, a lot of them were migrants. In the cleaning industry, all of these industries had a very high number of migrants, and it is incredibly important for journalists to tell that story. I want to zoom in very quickly on the vaccination campaigns that are coming up or have already started to be rolled out in most countries. It is very important that we understand that vaccinating everyone who needs it is incredibly important, regardless of their immigration status. So all countries have created, priority groups. They've said, first it should be the health workers, then it should be, I don't know, some countries said teachers, others said any frontline worker should be vaccinated first, and then persons above a certain age. We are not asking, and nobody is asking, that migrants be vaccinated as a priority. But the message that is very important to share in the media is that migrants should be included in each of the priority groups that governments identify, and that no migrant should be left out, including those who do not have the papers, the red tape, all the administrative requirements, the fees, all of that. It should be completely irrelevant in this case, not because it's the right thing to do, but because it is the smart thing to do. It's the only way we get out of this crisis. It's by prioritizing people in terms of vulnerability to the disease, vulnerability to the pandemic, and not based on immigration statuses. It is important also, if you're reporting for a national outlet, if you're reporting for if you're reporting on these vaccination campaigns in any way, shape, or form, it's important that we distinguish what governments are saying on paper and what is happening in practice. There are a lot of governments that are saying they want to vaccinate everybody, regardless of their immigration status, and that is wonderful. We are so happy to see that political will come in. But it's very important that reporters look into what is happening in practice, because sometimes it's completely innocent, that it's just a policy that was adopted years ago and that nobody remembered, but this paper is required, or this fee is required, or this language, there's no translators, or the information on where to get vaccinated isn't shared in a way that is mindful of migrants. And so de facto, without it being an intention, migrants might be excluded. And so that is an area of reporting that is really critical in these times. And I invite you to look into that wherever you are, whatever your focus. I think that's a story that can really bring up interesting information. Again, I want to emphasize in terms of the way we tell the story of migration health, and in particular in this pandemic, I want to emphasize the importance of busting myths about migrants as disease carriers. A lot of people, and how you tell the story is very important. That when you're a migrant and you cross a border, there are many ways in which you can cross a border. A lot of them do it after undergoing tremendously thorough health assessments, and being screened for tuberculosis, malaria, HIV/AIDS, you name it. And so a lot of them are among the healthiest, and yet a lot of them carry the stigma of being disease carriers, and it's incredibly unfair. And we have to highlight the contribution of migrants to societies across the world. In terms of finding stories and finding the data and the information and the regulations and the official legal language that supports all of this that I just presented to you, there's of course IOM is a great resource because it is present across hundreds of countries. So you can always reach out to a country office, and IOM is present in emergency and non-emergency contexts, and Saskia covered some of this. And IOM works across all stages of the migration journey, so before, during, and after migrants, or even after they return to their homes. And so it's a great source if you're looking for what gaps, what stories could be looked into. One of the things that regulates all of this is the 2005 International Health Regulations, in which countries have agreed to ensuring that whenever there's a public health issue like COVID-19, migration and trade can continue across borders in the safest possible manner. And nowadays, you're going to hear a lot about global health security and how to make sure that these international health regulations are improved to make migration even safer and trade even safer, and so that the socioeconomic impact we just felt due to COVID-19 doesn't happen again. So that's also a great place to look for stories on how the international health regulations are applied and what they say and the various impacts they have on life at local level. And then there's other organizations I want to recommend that you knock on. The World Health Organization, of course, the Refugees High Commissioner, the Norwegian Refugee Council, and the Danish Refugee Council all work on this topic. The Red Cross societies, the Red Cross and Red Crescent societies, sorry, there's a typo there. Of course, I should have added Red Crescent. PICUM, which is a network that focuses on undocumented migrants in Europe. And of course, the diaspora group. Make sure you speak to the civil society organizations who know more than anyone what is interesting and how migrants are affected. There are migrants everywhere. If you look around, I'm sure I'm speaking to a ton of migrants today, and they're an important group of people to look into, especially in this context of COVID-19. I will stop here now. Hope there's a bit of time for questions. Not much, I'm sorry. And you can take my email address, and if you have any questions, any interviews you'd like to carry out with IOM experts, I'm very happy to facilitate that. Thank you.
Yeah, thank you. And I think one of our participants actually asked for email address. So Miriam, I think you can quickly take that email address, and others that may also be interested in reaching out. And we have a lot of questions already. So I want the two of you to quickly help us out in answering as many as we can. There is this issue about what needs to be done, really, if you want to really reach out to migrants. And I think it's something that I've also experienced too. Unlike other individuals, it seems as if it's difficult to access migrants to tell their stories. So what do you think journalists that really want to reach out and talk directly to migrants themselves, what key and brief issues do you think they have to do to make it much easier for them to achieve?
Sorry, so that's the first question, right? What kind of challenges do you have to reach out to migrants? Yeah, so reaching migrants without documents in or in irregular situations during the pandemic is a tough one. It's a tough one at all times because, of course, by definition, these people are trying to be off the grid a bit. I really strongly advise that you reach out to people who are to diaspora groups who work at the forefront with them, and who will be able to help you tell those stories without putting them in dangers. But it is incredibly important that we adapt our communications with them in the languages that they speak, and that we are culturally competent in reaching out to them. And of course, just it's about building trust. So those are the three things. I realize we're out of time, so trying to be fast.
Okay, then there is also a question on mental health. I think not just one, there are several questions on mental health. So I'm bringing them together. For journalists that are interested in writing on mental health issues as it affects migrants, what are the quick tips that you can give them, and where is there any insight or direction that you think they can take to be able to achieve this when they want to write on mental health as it affects migrants?
Mental health presents a lot of specific challenges because mental health is extremely stigmatizing, especially in some migrant communities. So just the notion of bringing up mental health and the absence of knowledge in a lot of communities about mental health uh, is a very big challenge. What I can recommend to journalists is really that you reach out to the groups that are in charge. There's always in every country groups that are that are advocacy groups for migrants in difficult situations, including who are suffering from mental health issues. And so that's your entry point, right? If you need to have a trustworthy entry point with migrants, especially if it's on topics as delicate as mental health. I also would like to answer I don't know, was it Miriam, I think, who asked the assumption that migrants are disease carriers is related to racism and not migration understanding. Miriam, you're absolutely right. I'm sure there's a lot of people who are, you know, xenophobic because they just are racist. That is absolutely a possibility. I am simply saying that there is also used in the rhetoric against migrants and in the xenophobic rhetoric that we are seeing, there is a lot of reference to the fact that migrants are disease carriers, that they are coming to our countries bringing a lot of diseases, and that their travel is making viruses cross borders. And I'm just saying that at least that aspect is scientifically incorrect, and that it is our job when we tell stories to at least bust that myth. You know, when someone is a racist, it's very hard to combat that with facts because, you know, it's so rational that it's very hard to come with facts. And I'm just giving you a fact here to combat that xenophobic rhetoric, which is that is simply not true. Migrants do not bring diseases. It is the circumstances of how they migrate that can cause health to be better or worse. But migrants are not disease carriers, and that is an important myth to bust.
Now, so if Saskia is still with us, I would like this question to go to her. And I know IOM is actively involved in helping out with responses at displaced individuals, at internally displaced persons. So are there any insights that you think journalists that want to cover persons at IDP camps, what do you think they need to do, and what issues do you think they need to be looking out for? Saskia, is she still with us?
I'm still with you. Yeah.
Yeah,
Hi.
thank
Let me just let me turn on my camera again. Yeah, so before I respond to that question, I just want to highlight that my portfolio mainly focuses on migrant protection and assistance interventions, mostly from for so returning migrants, including victims of trafficking and yeah, any other vulnerability category that was just mentioned. We also have a program in place in the northeast of Nigeria, which is indeed focusing on internally displaced persons. Which is, yeah, we have several million people who are internally displaced in Nigeria due to the Boko Haram crisis. But if I can speak from my own experience in Nigeria on, stigmatization, I think what was mentioned earlier is very relevant. And one of the major issues that we see in Nigeria, I think that the main is that there's a lot of stigma on being an unsuccessful migrant. So most of the time, what reinforces irregular migration is that most of the time people are not willing to speak openly about their negative experiences. So they might come back and say, listen, my journey was fantastic. I had no issues at all. I managed to work. I managed to earn money, etc. But of course, that's not the case. So oftentimes people are aware of that stigma, and then they might not feel comfortable moving back to their village of origin. I also think in terms of IDPs, but also in terms of returnees, and it was already mentioned. There's this stigma that people are not equipped, people are not knowledgeable. The disease part is also an important part. So people might think that yeah, they're just a different class or a different type of person that is more inclined to bring out diseases, that are not smart enough, and generally, you should not be associated with. Um, I think in general, in terms of the stigmatization and the fact, that is very important to combat is the experiences that people go through during migration. So I'm looking at it from the perspective of preventing irregular migration, right? And I think in general, there's a lot of stigmatization about negative experiences. So people might come back and they have been victims of trafficking, right? For women, it's quite well known, or even then, there's a high degree of stigma on being a victim of trafficking, which has nothing to do with the person, right? But parents or the community might not accept you anymore, or yeah, there's a quite negative perception, and very much prevents people from finding jobs, from reintegrating. But we also see a very high level of male victims of trafficking, and because of the stigma in society, people don't really talk about it. And I think as journalists, you have a very important role to open up those taboos and to make, to allow that narrative to kind of take place, as opposed to, maybe a very biased way of reporting on migration. And I think personally, that's what I see here, but also in Asia, where I've worked before, is that there's oftentimes not a lot of attention on those kind of areas that are also important to tackle, like male trafficking trends, yeah, sexual exploitation, and also the prevalence of mental health and substance abuse issues. I think bringing those stigmas to the forefront and bringing that into news, I think, is the first step to actually addressing taboos that may exist and prevent us from addressing irregular migration in the first place.
So I would have loved to close, but I think we have two very important and sensitive questions from the same person that I would like either of you to take. And so the person is Abdulaziz Al-Masabi, and I think is an exiled humanitarian journalist. So the first question has to do about how do you reach, report, and address refugee and migrant issues in countries that haven't signed human rights agreements, countries like Indonesia, Malaysia, similar countries. And so how do you avoid foiling the issues and putting the my people at risk. Then there is also an additional question that why is exile journalists or refugee journalism an avoided topic underreported? And how do we handle being shaded and forgotten as an exile journalist who relocated for safety and other reasons leading to exile? Take as much as all of those questions as you can. So let's go. Let's start with Yasmina, then we'll end with Saskia. So Yasmina, over to you.
Yeah, I'm afraid I'm not competent to answer these questions because I'm specialized in health, so I don't think either of these questions are about health. Maybe
Saskia,
Saskia.
can you do your best? You are muted.
I can see that, yeah. Um, so I can partially answer that question from my own experience in countries where maybe some topics are taboo. Like, for example, in countries where, LGBT rights. So you have, when the laws are against the LGBTs, um, so in some countries it's illegal to be homosexual or transgender, and in those instances it's very difficult to come out and publicly indicate that you might be supporting such programs. um, Although it's very important to make sure that that group of people is also assisted. So in terms of language, some of the language that we then use is, like, to include all type of vulnerabilities, or inclusive of everyone. So you would have more general language, IOM's programs or programming focused on vulnerable individuals, inclusive. There's a term for it, but for some reason I cannot think of it right now. But so technically, you have to be a bit careful as to how you report on such things, but you still have some terms that you could use to indicate that people of vulnerable categories might also be part of any humanitarian crisis. Um, Usually what we do, and also when we work with journalists on topics like that, is whenever there's a need to report on issues like that, usually we organize training. So it's very difficult to give a blanket answer, to this question, because in one country, one term might be accepted, and in another country, another term might not be accepted. So if I can take it back to Nigeria, Nigeria is a very open country, but still, of course, there's taboos. But what we do with our networks of journalists is we actually have these sessions. How is reporting currently done in the country? Where do we need to focus more attention on, and how can we actually report on those topics that are sensitive to the cultural context? And I think if you're working in one of those countries, it's also important to have that network and maybe reach out to have that level of understanding if you're interested in reporting on such issues.
So thank you very much for that beautiful response. So Yasmina, you are the public health expert here in this issue. So what do you think is the take home? What do you think journalists should have at the back of their minds? What do you think they should be thinking about when they are looking for how to write, how to cover migration and migrants in this global pandemic? So let's give you like 30 seconds. What should they be concerned about?
Yes, 30 seconds. Two
Yeah.
things. One, think about everything you can do and a migrant might not be able to, and look there. When you go to a pharmacy, when you go to see a general practitioner, when you go to get vaccinated, when you go to get tested, think of whether migrants who might not have the same papers or the same status or the same financial resources, what would they do? That would be how I would approach looking for stories. And the second is look around you. Migrants are everywhere. They're getting us out of this one too. They're getting us out of this problem everywhere you look. They're contributing to the solutions everywhere you look. And anyone who is reporting migrants as being part of the problem is missing the story. So I I encourage you all to look for the helpers, and half of the time they'll be migrants. That's my message.
Thank you very much. I really appreciate your expertise, your thoroughness, and your ability to actually marshal these talking points. So I thank you, Yasmina Guerda specifically, and Saskia Kok for being amazing experts and trainers on this issue. I also want to extend our gratitude to the entire IOM team that were able to ensure that this came to pass. This is an ongoing conversation that we will continue to have, and as issues manifest that we need to approach them again. I trust the two of them and other members of the team will be interested and to help us out on these issues. So thank you very much once again, our panel of experts. So thank you, Saskia, and thank you, Yasmina. Have a lovely day. But because there is a lot, I think the questions that are still coming in, maybe I'm going to send them to you via email. We've run out of time a lot. And for our members that are still, for the journalists that are on this webinar, a lot of opportunities are available, like I always endeavor to bring them to your attention. So just visit highjnet.org/en/opportunities so that you can see all the available opportunities that you can benefit from. Is it training? Is it new jobs or new opportunities? They're always there for you. And I really want to thank you for joining us today. And I hope this webinar helps inform you better on the topic of covering migrants and migration in the global pandemic. And more importantly, helps inspire potential new angles for stories. And if you're not a member of the ICFJ Global Health Crisis Reporting Forum yet, I encourage you to please find the group on Facebook. For more information about the forum, I would advise you to visit icfj.org. And if you would like to access journalism resources on COVID-19, please check out the International Journalist Network at www.ijnet.org. And please don't forget to fill out a survey that is coming to your inbox after this webinar, and because ICFJ would love your feedback to improve programming for this series. This continues next week, and next week, if I can give you a teaser of what we are talking about next week, just yesterday, the president of Tanzania died, and Tanzania has been a very popular country as far as COVID-19 is concerned. So our trainer for next week was one among those that tried to organize a COVID-19 vaccine trial in Tanzania using a Chinese version. So we'll be looking at an expert that is well versed on the gray areas of COVID-19 vaccine, and that's something that I would encourage you to participate in. So thank you very much, and I will see you next week. So we go out in 5, 4, 3, 2, 1. Thanks, everyone.